Often when we're teaching beneficial poses like legs up the wall to support our students with edema, there could be some students that have acid reflux, or perhaps laying on their back just isn't comfortable because of compression from the baby. And so this setup, I have one chair and two bolsters, but the bolster underneath could be substituted with a block if you'd like. And Stephanie's going to lay back on the bolster, which is at a 45-degree angle, and then drape her legs over the chair. And so if we have use of a chair, this could be a nice option for a lot of our students. And it is also possible to have these bolsters close to the wall, and for some students, elevating their legs using the wall could feel comfortable as well. And so I like this chair setup because it's a little bit more gentle in a lot of ways and easier to come in and out of the pose.